Good morning, everyone. I'm Juliana Nahas, MD. I'm a pediatrician in Covington, Georgia, and this is Dr. Carolyn Schweitzer. She is a dentist in Massachusetts, I believe. Is that correct?
Right, with a subspecialty in sleep medicine.
Awesome. And we wanted to talk to you today about the airway and sleep and how inflammation can impact those activities in your life. So I'll let Dr. Carolyn start with her observations in her clinic. And really, we started conversing about this topic in another group that we're both in because we saw very similar patterns emerging in our patients. So Carolyn, what have you been seeing in your clinic?
Well, one of the things I do routinely when I screen patients is look at their airway. And that's to look and see if everything is wide open in the back of the throat so that air can passively circulate while you're sleeping. And I see a lot of very large tonsils that I can't explain. And I'll talk to patients about it. They're not aware of any allergies or food problems, but I know that tonsils aren't supposed to be big in an adult. They're supposed to recede as you mature and become invisible.
Right.
And we see a lot of inflammation in the mouth. We see bleeding gums. We see gum disease. And I believe this is just the first part of the gut. The whole gut has a microbiome. And I think what's going on here is a reflection of something is off.
Yeah, I agree with that. So I've been trained in functional medicine as well as pediatrics, and definitely from the functional medicine perspective, we look at inflammation as a trigger for major diseases in the body. So inflammation anywhere in the body could signal inflammation in the gut as a starting point. And I'm going to talk a little bit more about that as we go along. But basically, if you see gum disease or periodontitis, it's really a symbol or a signal that this inflammation is going on through the entire mucosa down your gut line as well, and maybe in your sinuses, in your lungs. So any other mucosal surfaces, even the bladder, can be involved. Is there anything more you wanted to share on your observations?
Only that if somebody's out of balance, it's more difficult to get them healthy. We can treat gum disease, but it's not just a matter of removing irritants in the mouth and voila, it'll keep coming back. And there's a reason it keeps coming back.
And that might be something nice to share with our audience. Like, what tips do you give your patients to help with gum disease and dental disease in terms of other than brushing your teeth and flossing?
Yeah, I try to tell them in terms of periodontal disease, dental cavities are an infection too. It's just another kind of bacteria attacking really the hardest substance in your body. But as far as gum disease, I explain to them that we have these colonies of bacteria that are building their cities under your gum line. If they can live under the gums, they're living without oxygen, and that's a very aggressive type of bacteria or pathogen. We break up those cities, so to speak, with our mechanical cleaning, deep cleanings, we call them. And so the inflammation, the disease, it calms down, it resolves, but they start rebuilding immediately. So if we don't go back every 90 days to break them up again, you end up right back where you started. So much like diabetes, you don't cure it, you treat it and maintain it. It's a lifelong chronic disease.
Yeah, it's more about maintenance and control, damage control than permanent cure, right? Yeah. It's almost like a daily habit that we have to maintain, just like you drink water and you sleep and you exercise. There's things you need to do in the mouth to maintain hygiene and to maintain a good environment for the healthy bacteria to live and not allow the pathogenic bacteria to live.
So with the right balance, what I'm looking for is to help people get better sleep. Really just that situation in the mouth is telling me that things are off. You have bacteria in the gut that probably aren't releasing the right chemicals or byproducts, and some that are releasing actively harmful byproducts. And you're here.
And building biofilm, right? Like there's some biofilm that kind of, can you get rid of biofilm with flossing and brushing?
Yeah, you can temporarily. That's why we have to do it regularly.
And there's a product I recommend to people. It's called Dental Sidin. It's from the Biocidin line, which helps to break up biofilm. So it's a special toothpaste that I've found to help break up biofilm in the mouth. But obviously, if there's biofilm in the gut, we have to treat that as well. So let me take a step back and just talk about why is there inflammation in the gut in the first place? What's going on in the gut? And what's stemming this whole inflammation cycle or spiral into the body? When we eat food, it has to be digested properly. And if it isn't, then it creates sort of this putrefaction in the stomach. It just sits there and decays. And decay attracts bad bacteria. So that kind of starts the snowball of events further down the gut into the intestines, where if your immune system is now triggered because it's seeing bigger protein particles or undigested carbohydrates and fats, the immune system now engages in a war. So it's not only looking to screen for pathogenic bacteria, viruses, and parasites, it's also looking at these funny looking molecules. We call them Franken molecules because they've been genetically modified foods or, undigested foods that are now triggering the immune system that sits right under the gut lining cells that absorb the food. And so they launch immune cells, and they launch cytokines, which are these chemicals that attack and kill cells. And you have a whole range of inflammatory markers that are now going haywire. This also triggers the lymphatic cells like T cells and B cells to create either killer cells or immune globulins that target these specific proteins and molecules in the gut to allow the macrophages or the other white cell groups to attack and engulf those food particles, let's say, and handle them through the immune system, through your lymphatic system and your circulatory system. If this war is not abated soon, the immune system starts to look for similar protein particles in the body. So you may have similar protein receptors, let's say, in your tonsils or in your thyroid or in your brain or in your joints. And that's why we start seeing more of a disease state evolve. So if it attacks the pancreas, we start seeing symptoms of diabetes, or if it attacks the joints, we start seeing arthritis, and so on and so forth. So it's a very convoluted, complicated chain of events. Obviously, I'm summarizing here and trying to crunch it down into something more, discussable in a short period of time. But let's go back to the airway, Dr. Schweitzer. And, you notice a lot of inflamed gum tissues and tonsils when you look at people's mouths. And your theory was that, maybe they've got some food allergens, or maybe they've got some other, inflammatory triggers going on, right?
Sure. One other cause is mouth breathing at night. So your nose is supposed to be the filter for your air that you're breathing. If you're congested here, your mouth drops open, and now the tonsils have to become the filter, and they weren't designed for that. So they're getting overworked, and that will enlarge them. So that brings us to this area too.
The sinuses,
congestion, sinus. Yep. And there's a microbiome everywhere. There's one there too.
Right. Right. So my theory on the enlarged tonsils is it's just a sentinel station. It's just one station in the immune system that's trying to handle bacteria and foreign invaders. So you've got probably other inflammatory nodes throughout your body. They might be in your gut. They might be behind your sinuses. We call those the adenoids. They might be, in the rest of your extremities and so on. So you might feel them. If you feel down your neck, you might feel like, oh, I've got a lump there, or several lumps. When you get strep throat, for example, those tonsillar nodes here get really, really large and tender. And they're just doing their job. They're not wrong in being inflamed at that point because you have an active bacterial infection. But when it's kind of chronic and indolent and never goes away, the body can't heal from that. Once you get into a chronic state of inflammation, the body can't reverse that at that point. We have to do more drastic interventions to calm the inflammation down, right?
Right. So what do we do?
So what do we do?
Mhm.
Well, in functional medicine approach, we look at the diet. We look at what are foods that the person is eating that could be triggering that inflammation, basically in the gut, and then downstream going to the tonsils and inflaming the rest of the body. The biggest culprits we found is gluten, and that's a protein we find in bread and other flours like barley and rye and so on. So part of what I do in my clinic is I take my kids, my patients off gluten. The next big protein that is very similar to gluten is casein, and casein is found in all dairy products. So that's from sheep, from cows, from goats, all the dairy animals have casein. So it's not just a substitution from milk of the cow to milk of the goat. We really have to go off dairy altogether. And usually I have them substitute with a nut milk as long as they don't have a nut allergy. And it's interesting that the sensitivity to these foods, the gluten and the casein, for example, is not a true allergy. It's a different part of the immune system that's being triggered. So it's confusing for people when the doctor says, well, you need to stop eating those foods. In their mind, they're thinking, but I'm not allergic to that food. Why am I reacting to it? So it's just to be clear, there is a different pathway that involves the immunoglobulin IgG and IgA, whereas the allergy is involving the pathway of IgE mediated histamine release type phenomenon. So there's a little bit of a distinction there. So some other foods that I found to be culpable in creating food sensitivities include corn, soy, eggs, even sugars and artificial sweeteners. I've seen it with citrus fruit, with chocolate, with shellfish, with peanuts. So the list can get quite large. For people who have arthritis, for example, we advise them to remove all nightshade vegetables. That includes, potatoes, tomatoes, peppers, and also some spices like cayenne and paprika. But for
The
most
nightshades all have lectins, right?
lectins and whatever other triggers, I'm not really clear what it is exactly, but they all have some common set of chemicals that are flaring up the immune system. Yeah, so for people with arthritis, we recommend no nightshades. But most kids with tonsillar enlargement in my clinic, like they don't have arthritis. It's just they can't breathe. They have chronic sinus or recurrent sinus infections or strep throat or ear infections. So my goal in my clinic is, let's reduce this by changing the diet and seeing if the inflammation can go down, right? Yeah.
Yeah, I know. I've been off dairy since 1992. I had a grandmother who was told. So we're going all the way back to the 70s when this wasn't common knowledge. Her doctor said, you've got to get off dairy. She
Very
said,
astute. Yeah.
but I love my cheese. So
Yeah.
she always had a Kleenex stuffed down her bra or rolled up her sleeve because she was constantly clearing her throat. She was congested. Same issue here. And when I was told you have to get rid of dairy, it made perfect sense. And that's not an allergy in the sense of, histamines being released and sneezing and runny nose. It's an intolerance more. It's an oversensitivity or overreaction.
Right. Right. Yeah, when we do the food allergy testing, if you will, or food sensitivity testing, it's the IgA and IgG levels that are high for these food components. So not the IgE necessarily. I mean, you could have a peanut allergy and that's involving IgE mediated, or an egg allergy, which, that you can react to albumin and egg whites and egg yolk and so on, but you can also have a food sensitivity only.
Right.
So my best practice is when you try to remove those foods, observe at least for 3 weeks without eating any of those foods to see if the symptom of inflammation go down, including the airway opening up and having less snoring and less, sleep apnea symptoms and so on. And after that, what we can do is re-challenge one food group at a time. So if you're really missing your bread, you can start with that with the 4th week and eat it for 2-3 days in the first part of the week, and then watch what happens the rest of the week to see if your snoring or sleep apnea symptoms kind of come back. If they do, then that food should be more or less permanently remove from your diet, and continue to use substitute products like rice flour, rice crackers, rice pasta, etc. Okay. And so when we re-challenge, we'll re-challenge one food at a time per week and kind of make lots of notes, because we really want to prove to ourselves that this food is indeed triggering us in some way, right?
So a food diary.
Yeah, we definitely need to keep a food diary. I mean, I do what's called an MSQ. It's a medical symptom questionnaire before we start the elimination diet, and then a month after. And then during the re-challenge, we do it every month to kind of track and see where we are, if we're regressing or not, as we reintroduce those foods. Because sometimes the symptoms are so subtle, you really don't notice, you know, like you feel better, but you don't notice the progression over time of how you got better. So unless we take, you know, some kind of notes and track our symptoms, we're not going to see day to day any change.
Mm-hmm.
Yeah. Do you have any questions about what I said?
Well, food substitutes. One thing I've noticed with dairy, because you mentioned casein, is there's a lot of substitutes out there. You know, so I've gone for the non-dairy cheese or the non-dairy yogurt. You have to look at the ingredients because a lot of them have casein in them. So
Interesting.
that's one thing I've learned with, you know, trying to, because you miss those foods, you crave them, you want to
Yes.
find something that you can eat in the place, but you have to look at ingredients.
Right. And, you know, a lot of times the substitute cheeses are made with soy.
Yes.
So that's another food that's forbidden. So I would say for the time that you're doing the elimination diet, you don't really want to include those foods, and you may have to go without eating cheese substitutes for a while until you get your system back on track. And then when you re-challenge, you can experiment with soy products and see what happens when you eat the soy products.
Mm-hmm.
Incidentally, soy sauce has soy and wheat in it. So you're getting a double whammy with soy sauce. One substitute I offer is cocoa aminos, and you can get that under the Bragg brand.
Yeah.
You know, tastes just like soy sauce, maybe a little saltier. So I would go a lot more gingerly on adding it to your sushi or other foods that you want to eat.
Yeah.
Um,
Now, if you have foods, for instance, I was looking for a coffee substitute and you're trying to avoid the grains. So say like a chicory coffee is brewed, it's made with extracts of grains like barley, rye, I think. So the grain extracts are also a no-no?
I guess it varies by the brand. So there are certain brands that do their products a little less allergenic. They use a different extraction process. I found one company called Kamano Island. They don't have chicory. They just decaffeinate their coffee with a Swiss water method. And I love their products because I can drink their decaf coffee and not have any buzz or any caffeine in my system. And I love the taste. It's organic. It doesn't have mold in it. Like they've really taken a lot of steps to make it as pure and healthy as possible. So you just have to look sometimes and read labels, and a lot of the companies will disclose their processes. You know, you could do teas, so like dandelion tea or Rubio's tea. So instead of drinking coffee, you could substitute an herbal tea that's naturally decaffeinated or uncaffeinated, right? I wanted to share some of my story growing up. When I was about 7, I had to have my tonsils taken out because I was getting recurrent strep and missing a lot of school. And I remember the process was very painful. I couldn't eat or swallow for about 3 weeks. And they gave me a ton of ice cream to just get me going, right? Which is the wrong thing to do when you have inflammation. But back in the day, we didn't know any better. Then when I was about 15, I started developing some mysterious autoimmune symptoms like cold urticaria or headaches, or aches and pains in my joints, but no swelling. So it wasn't like arthritis. And then fast forward into my 40s after I had my children, that's when it hit me big time. I went into full-blown like fibromyalgia, chronic fatigue, and really racked my brain and consulted all my friends that I could find to help me through this difficult period. But as a traditionally trained doctor, we didn't have the information that functional medicine brings to the table. So when I finally stumbled on that method and followed a doctor who was trained in functional medicine with a system, a proven system to do the elimination diet and do the challenge, with a lot of hand holding, because it's new. Nobody's done that before. Nobody's taught us that before. So it's a system that I think, or a method that requires some support. I would not advise people to do it on their own unless they had a really good book or a coach or somebody who knows how to guide them through it. But within 4 months of doing that elimination diet process, I was healed. I was completely back to normal. So it's phenomenal, right? And I am allergic or sensitive to dairy, to wheat, to soy to some degree, and even corn. And I have to really watch when I eat my grains that when I buy those products, they have maybe just quinoa or rice, but none of the other ingredients.
So when you say you need a lot of support, if somebody wanted to do this elimination diet on their own, do they need professional support? Do they need support of a group that's doing the same thing? Is it both?
Any of those. I think just going it alone is very discouraging and confusing because there's a lot to sort through. And there are different slants on the elimination diet, right? So I mentioned, like, if you have arthritis, take out the nightshades. If you don't, you don't. So you need somebody to help guide you in your particular situation. What's the best diet or recipes to follow? And when is the best time to re-challenge? When is your body ready to start meeting the re-challenge period? Because we want to do a cleanse for at least 3 weeks, sometimes longer. Depends on the patient and how many symptoms, on the MSQ, how much scoring is elevated. If your score is 20, we would approach it differently than if your score is 100, right? Because you have more inflammation with a higher score. So your body didn't get there in a week or a month. This has been building for years. And really, that's why I shared my story. It's something that started when I was 7 and just continued on and on into my 40s. And it's not easy to notice. It's not easy to say, oh, I know this food is bad for me. You cannot tell because you've been eating that food your whole life. So it takes a little bit of a scientific approach and a little bit of support, whether it's from you as your dentist or me as your pediatrician or a coach or a nutritionist, or like you said, even a Facebook group that's doing it together. Somebody needs to help guide you when you have questions.
Also, if your family's not doing it with you, that makes it hard.
Which was my case when I did it. And I've done it several times now. When I do it, my family doesn't wish to join me. So I'm on my own and I have to cook in a way that's both sustainable for me because I'm busy, but also allow them their cheating, if you will.
Right.
Their macaroni and cheese, they can have it. I just don't eat that.
Right. And you have to be able to say no to all those foods that are there that aren't for you.
Yeah. What I found though, like after the first week, the cravings start to simmer down. Unless you go hungry. So that's a big tip with the elimination diet is you don't want to let yourself go hungry. You always want to have a healthy snack that you have at your side, whether it's a handful of nuts or some hummus and celery sticks, but something to eat on, or leftover chicken from the night before, because you don't want to let yourself go hungry. And there's no calorie counting, which is nice. You can eat as many vegetables that are on your list. There's some fruits on the list, not a lot. And the reason is because some of the fruits have too much sugar and we're trying to lower the sugar intake because that's also inflammatory.
Right. Yeah, sugar's a tough one to give up.
Yeah.
And I like that you're not counting calories. With the foods you're eliminating, those calories are dropping anyway because you're getting rid of a lot of high calorie foods to begin with and addictive foods, I think.
But I found
you tend to binge.
Yeah, during my elimination diet, like I ate more because mentally you're thinking I'm depriving yourself, so I'm going to eat more of the stuff I'm allowed. So I ate more, but I lost about 15 pounds during that time. And it's not the volume of what you're eating, is that the foods you're now eating are not triggering inflammation. And inflammation causes swelling in the fat cells. So then that leads to obesity and gaining weight. You're trapping water and fat. It's kind of a dual process. So when you avoid the foods that cause inflammation, that naturally kind of sheds off without effort, it feels, because you're still eating, you're not letting yourself starve.
Right.
Yeah, and another tip is drinking a lot of water. So waking up and starting your day with a glass of water and trying to get about 8 glasses of water throughout the day. Not too late into the night, because then you'll be up all night, but
Yeah.
we want to have good sleep as well, right?
Right. Yeah.
And, I don't know if you wanted to say a little bit about sleep some more.
Sleep is something I cover in just about every aspect of what I'm doing. So my followers are going to get a good background just from my course content. But
That's great. Yeah.
just really, really important to good sleep is a wide open airway. And so if we can get those tonsils less inflamed, if we can get your whole digestive tract calmed down, you're going to have a much better night's sleep.
Well, it's really beautiful to see. I mean, the dark circles under your eyes will go down, the puffiness goes down. You'll see the contouring of your face start to come back. You won't have the chipmunk cheeks. They kind of go down. Even here, because of the adenoids regressing, you'll see sort of a flattening of the maxillary facial area. So there's quite a transformative change that happens to your face alone, let alone your body, when you do this diet. It's quite life-changing.
Yeah, great.
Yeah.
Awesome. Well, thank you very much.
Yeah, you're welcome. I hope your followers get lots of benefits of this, and they can find me on my website at covingtonpediatrics.com if they have any questions. Of course, I can't practice out of my state boundaries, which is Georgia, but I'm more than happy to offer a redirect or a consult if that's what's needed.
Beautiful.
Thank you, Caroline.
Thank you.
Wonderful interview. All right. See you next time. Bye-bye.
Okay. Bye.